Good afternoon, everyone, and a huge and warm welcome to our British Heart Foundation live and ticking event. It's just so lovely to have so many people join us for today's event, which I know is going to be absolutely brilliant. So thank you for joining us. My name is Dr. Charmain Griffiths. It's my privilege to be Chief Executive of the British Heart Foundation. And we're really looking forward to this hour with you on this Wednesday afternoon in January, because in particular, January is often a month where we're really reflecting on the year and also making habits that are really important for our heart health. And we're really excited to be spending some time with you today to perhaps reflect on health and hear a little bit more about latest research, as well as some personal perspectives to bring that to life. And in particular, we're going to be talking a bit about exercise and how important regular exercise is for our cardiovascular health, and also how powerful it is in helping to lower things like blood pressure, cholesterol, and helping our bodies really regulate sugar as well. So I know many of the people who are on this call today have already submitted questions and thoughts to us about being worried about exercising after surgery or a cardiac event. And we just want to spend this session today sharing with you our advice as a British Heart Foundation and some of the work that we're doing, but also helping answer some of your questions, because of course it's natural to wonder whether it's safe to exercise in such situations and how to do it, and how to look after yourself during recovery to strengthen your heart. Because no matter who we are and where we are, there are always things that we can do to keep our hearts healthy through eating a balanced diet and exercising as much as we can. Now, as you're listening to us today, if you've got any thoughts or questions, I'll come back to that in a moment, but please do share them with us. But I wanted to also remind you that there are so many brilliant resources on our British Heart Foundation website. There's a fantastic Health Unlocked community where people with heart and circulatory diseases and loved ones and their families come together to share things about their experiences. And Dave is going to be posting a link to that in the sidebar so everyone can see. We've also got some fantastic support and information that we'd love to share with you. We've got a fabulous cardiac rehabilitation exercise video you can do at home if it's difficult for you to get into physical cardiac rehabilitation. And again, we'll post the link. And lastly, I would like to take a moment actually to say that we're so proud of the team behind our information and support and our helpline. And you'll be meeting some of my colleagues today from our Heart Helpline who have supported millions and millions of people through our website and by taking calls over the course of the last 20 months through the most difficult of times. So you're going to be meeting some very special people from our BHF team in a moment, but just want to say how proud we are of them and the lifeline they've been to many people. And of course, as the Omicron variant, we hope, starts to settle for us certainly across the UK's 4 nations, and we hope we're looking at a brighter 2022 ahead, we also recognise that it's a real worry for people with heart and circulatory disease to think about how to get out and about and stay active at a time when the virus perhaps poses a higher risk. So please have a look at our coronavirus hub. I mentioned 11 million people have already found it a lifeline. And there might be something that you or a loved one find useful there. So please do take a look at that as well. And as we think about exercise in our hearts today, and really welcome a discussion with my 2 brilliant guests I'll come to in a second, but also with you. If you are inspired to do something, or if you're a loved one of someone with heart disease and are inspired to do perhaps a bigger piece of exercise in the year and set yourself a challenge or a target, we've got 2 great events. We've got our Brighton off-road bike ride happening in June, so please look out for that. And we're also very proud to be the official sponsor of the London Marathon this year, which is absolutely going to be a game changer for people with heart disease, given the amount of money it raises to fund powerful research to drive progress and treatments for people. So please do keep an eye out for those. And if you know anybody who's interested in doing the marathon or indeed the off-road London to Brighton bike ride, please do let them know. But without further ado, you're here, I know, to listen to mostly our brilliant speakers today. They're going to be telling us more about the exercise in the heart. And firstly, I'm delighted to be joined by Professor Sanjay Sharma, who is Professor of Sports Cardiology and Inherited Cardiac Diseases at St George's University of London, who'll be sharing his research into the relationship between years of endurance exercise in athletes and the development of atherosclerosis. So I know I'm looking forward to hearing Sanjay describe more about his work. But we're also really, really honoured to be joined by Olympic silver medalist and BHF Ambassador Roger Black, who'll be discussing being diagnosed with congenital heart disease and also sharing his top tips to stay active with us as well. So wonderful, Sanjay and Roger, to have you with us. Thank you for making time as part of our BHF family to join us. And also you'll be hearing from two very special colleagues I mentioned earlier, Ruth, who's our senior cardiac nurse, and Tracy, who's our heart health dietitian, for a Q&A session. So that's enough for me to set the scene. Please do post your questions in the chat, and we're going to try and get through as many of them with you today, with Sanjay and Roger, and look forward to hearing your thoughts and any comments you might have to share with us as well. But without further ado, let me pass over to Sanjay. Sanjay, over to you.
Well, thank you very much. It's a real pleasure to actually be speaking to people who raise so much money for such an amazing cause. I'm going to share my slides with you now and just get prepped. I'm going to talk to you about exercise, and the great news about this is, of course, I'm going to talk to you about things that you don't have to be prescribed by a doctor, things that you can do at any times, things that are free, things that are available to every single person, no matter what your socioeconomic status, and something that's more palatable than drugs and probably has more benefits than any medication that we've ever invented. So I'm going to talk about exercise on the heart, but I'm going to give you an overview, talk about the good, the possible bad, and maybe even the ugly. So I'll discuss the cardiovascular benefits of exercise. I'll examine the potentially detrimental effects of too much exercise, and then briefly discuss the risk of sudden cardiac death during sport. So let's talk about the good. The benefits of exercise on the cardiovascular system are really well established. People who exercise regularly are less likely to be overweight and have diabetes. They usually have a better blood pressure and cholesterol profile than people who don't do any exercise. And by curbing all of these risk factors for atherosclerosis, people who exercise regularly reduce their risk of having a heart attack by about 50% when they reach their 5th and 6th decades. And this was shown very nicely by a chap called Morris and his group, who basically compared heart attacks in busmen, where they compared bus conductors in the old days who were going up and down the stairs collecting fares versus bus drivers. And they compared postal workers, i.e. the active postmen, versus the clerks who were sedentary. And they found that the active personnel reduced their risk of a heart attack by about 50%. Now, some of you will say, well, I've already got high blood pressure, I've already got diabetes, I've already got a high cholesterol, I've had a heart attack. Is that it for me? I mean, can I benefit from exercise, and how safe is it? Well, here is data in about 131,000 people with recognized cardiovascular disease and 310 people who weren't doing much, who didn't have any cardiovascular risk factors. And these guys potted around being active, and they were followed up for about 5.9 years. Now, the red bars are people with cardiac disease, and the blue bars are people without cardiac disease. And on the x-axis here, you see increasing number of exercise. Now, you see that whether you've got cardiovascular disease in the red bars or no cardiovascular disease in the blue bars, the more you exercise, the lower you reduce your risk of something bad happening to you. But you will see that the red bars, these are the people with cardiovascular disease, seem to have a much bigger benefit in relative terms than the people in the blue bars. So if you've already had cardiovascular disease and you're thinking of doing gentle exercise, then you are probably more likely to do yourself a better favor than someone who's never had a coronary event or any risk factors who does the same amount of exercise, probably 14% reduction of risk versus just 7%. And if we look at the amount of work you actually have to do, in the blue bars are the people who actually don't have cardiovascular disease. They get their most benefit when they exercise for about 30 minutes a day, gently. But people who've got cardiovascular disease continue to get that benefit, even if they exceed 30 minutes and go up to about 60 to 90 minutes. So what this slide tells you is that not only should you be exercising if you've got cardiovascular disease, you should be doing just a little bit more than the current government recommendations. Many of you that are tuned in may be sort of in your 7th or even 8th decades. And this slide tells you that it's never too late to start. So again, this is a huge study, over 1 million people with a mean age of about 67 years old, many of whom had high blood pressure, high cholesterol, and diabetes. And some of these people, a large proportion, either stopped exercising completely, and the other lot started exercising for about 4 or 5 years. And they found that if you reduced your exercise at that age, you increased your risk of cardiovascular disease by 27%. But if you decided to start exercising relatively gently, you improved your cardiovascular risk by 11%. So this study shows that it's never too late to start exercising. So apart from it preventing you from having heart attack, exercise also prevents people from developing atrial fibrillation, which is one of the most common arrhythmias that we deal with, and a lot of work that has been done by the BHF. And if you do have atrial fibrillation and you exercise regularly, you reduce your risk of strokes and dying prematurely compared to people who don't exercise. So what are the benefits of exercise on risk factors for atherosclerosis? And you will see they're quite modest. Systolic blood pressure is only dropped by about 5 millimeters of mercury, diastolic blood pressure by 3 millimeters of mercury, cholesterol by 5%, LDL cholesterol by 2%, body mass index by 1.5%. But we see far, far better benefits than this with exercise. And that's because exercise doesn't just reduce risk factors for atherosclerosis. It does lots of other things in the body that improve fitness. And fitness is probably the strongest marker of general longevity of life and disease processes. So here we go. Exercise reduces your risk factors for atherosclerosis, but it increases heart size, it improves cardiac function, it improves the stiffness of your aorta and your other vessels in your left ventricle, it stabilizes the coronary plaques in your arteries, it improves the way the muscle takes up oxygen, it modulates your electricity of the heart, and it reduces inflammation. So exercise does so many things, and by doing this, it reduces your risk of atherosclerosis, improves fitness, and increases longevity. In fact, people who exercise live around 7 years longer than people who don't exercise at all. And here's a bar chart looking at fitness levels versus cardiovascular deaths. And you will see on the x-axis, this is level of fitness called METs. The fitter you are, the more you reduce your risk of dying. So for every 1 MET that you can exercise, you reduce your risk of dying from a cardiovascular event by 13 to 20%. No drug has ever shown these benefits. And these benefits apply to the young, the old, men, women, different ethnicities, people who've got comorbidities, and even people who are ostensibly fit and well. And I don't want to keep going on about exercise, but it also reduces your risk of cancer and lots of other things as well. So these are the guidelines. Everyone that is able should be doing 150 minutes of moderate intensity exercise or 75 minutes of vigorous exercise per week, divided in 3 to 5 doses. Everyone should be doing that, a minimum, I would say. You should actually be doing twice that if you really want to do really well. So you should be doing 300 minutes of exercise. Now, I don't mean go on the track and sprint up 400 meters. I'm talking about walking to the shops and climbing stairs and using your bike whenever you can, or going for a gentle swim in the pool, going on your treadmill or your watt bike. So 300 minutes divided over 5 days is what you need. And again, I said this should be divided over 4 to 5 sessions. For those of you that have got musculoskeletal abnormalities or other abnormalities, any exercise that you can do is better than no exercise at all. Now let's talk about our creme de la creme, our endurance athletes. These people do 15 to 20 times more exercise than what is recommended. So what happens to them? Well, we know that because they have to pump 30 liters of blood around the body per hour, they have to make some adaptations in the heart. The heart grows in size, and electrically, we see that the heart's slow, it's big, it fills very, very well, and it contracts extremely well. Even at rapid heart rates, it pumps loads of blood out. And these athletes have very funny looking ECGs, which people like me are used to looking at. These are very normal ECGs. Clearly, if someone with heart disease had an ECG like this, or if someone with high blood pressure had an ECG like this, I'd be a little bit worried. But they have very big QRS complexes, and if any doctors are tuned in, then obviously the voltage criterion for left ventricular hypertrophy is present in around 70% of athletes. They get a 10 to 20% increase in the thickness of their heart muscle, a 10% increase in the left and ventricular cavity size, and a 45% increase in the left ventricular mass. And if you actually look at the distribution of the heart size that these people have, the red bars are the women and the blue bars are the men, you'll see that men get bigger hearts than women. That's because they're usually bigger, they've got greater lean body mass, and they can exercise more than women do. But what I want you to take on board is that around 48% of our athletes have cardiac dimensions that exceed those of the general population. And sometimes if you're looking after an athlete and you see a huge heart that looks a little bit lazy, you can sometimes misdiagnose them with something serious, such as a cardiomyopathy. And I've spent most of my career researching methods by which we can correctly differentiate between cardiovascular adaptation in athletes versus those in non-athletes, clearly because an erroneous diagnosis has very serious consequences. You tell someone who's actually got a cardiomyopathy that this is all athlete's heart, you may jeopardize a young life. Conversely, if you tell an athlete he may have a cardiomyopathy, but he's got a completely normal heart, you may have cost him his career. So I've spent so much time doing this, and the BHF have helped us very much to devise algorithms that are used worldwide to differentiate between disease and physiology in athletes. So I put the bad in question mark and through gritted teeth. So let's talk about what you've been hearing. A lot of you all know that people who run a lot do well. So this is a huge study in runners in their middle ages who showed that runners had a 30% reduction in all-cause mortality and a 45% reduction in cardiovascular events. But here is a relationship between the reduction in your cardiovascular events and the amount of exercise you did, i.e. running distance, running frequency, total amount of running, and your running speed. And you will see that every single one is a U-shaped curve. That there is a point at which you get your most benefit, and there comes a point beyond which you actually don't achieve any cardiovascular benefits. That's not to say it's bad, but there is this U-shaped relationship. And for the best results ever, you should be running between, this is for the best results, 6 to 12 miles per week. I don't want you all to do that. Divided in a frequency of about 3, running at a pace at about 6 to 7 miles per hour. Roger's already holding his chin thinking, oh, that's way too low for me. But that's what you need to do to get the best benefits. Clearly, our Olympiads do far more than that. And they may have an increased longevity of life, but I don't think they accrue any additional benefits by doing more than that, except for to achieve their aspirations. And does too much exercise harm? Well, we've got rat experiments. These are rats that were made to exercise for 60 minutes. That's like running a 10K quite fast every day for 16 weeks. And then they were sacrificed. And they found that these rats had big atria. These are the top chambers of the heart. They had scarring of the right ventricle. They had stiff hearts. They were more prone to developing arrhythmias. Clearly, it's an animal model, and these guys were forced. They were electrocuted every time they stopped, which is not the way humans run. But since then, of course, we have had some data to suggest that middle-aged and older individuals that have run all their lives, including some of our former Olympiads, have a higher prevalence of a condition called atrial fibrillation. In fact, atrial fibrillation is 5-fold more greater in middle-aged endurance athletes than in our sedentary population. It is much more likely in males aged 40 to 60 who have engaged in endurance sport for at least 21 years and who are tall. They're the sort of people that get atrial fibrillation. But unlike our general population who gets atrial fibrillation, who may have a stroke, who may develop heart failure, who may double their risk of dying, athletes don't seem to have that. So I think the benefits that they achieve from sport seem to mitigate all the other risks that the sedentary population have. You may have heard that people who run a lot get furring up of their coronary arteries, and you think that's very counterintuitive, but even get scars. There was a study in one of the marathons where they looked at marathon runners, and they showed that they had more calcium in their coronary arteries than sedentary people of the same risk profile. So we did our own research, again, really thankful to the BHF and all of you to fund this. We said, look, some of these guys must have had risk factors, either running away from their genes, probably started off a bit fat, smoked a lot, had high cholesterol, and decided to turn to running. So let's do a clean study. Let's get a lot of people who've never smoked, never had high blood pressure, have an absolutely normal lipid profile, and don't have diabetes. Now you can imagine we really had to sieve out lots of people to find this. And I want to present our data in people who've exercised for 31 years. 77% of those are marathon runners, median marathons, 13 marathons, 16 national champions, and world champions. And we looked at coronary artery calcium score, which is a marker of atherosclerosis. We found no differences between controls and athletes in the amount of calcium that they had or didn't have. But when we looked at a coronary artery calcium score of over 100, so the higher your coronary artery calcium score, the more you've got, we did find a signal in that almost 1 in 5 athletes had a coronary artery calcium score of more than 100 versus only 7.4% of the general population. And we started looking at these people in a bit more detail. We looked at the people with the highest coronary artery calcium scores, i.e. coronary artery calcium scores of over 300. We only found these in athletes, but not in controls. So we found this in about 11.5% of athletes. Then we started looking at the plaques, the little deposits in the coronary arteries, where the controls are the blue bars and the athletes are the red bars. And we looked at the number of plaques, and you'll see that whereas the controls only have 0 or 1 plaque, athletes had multiple plaques. Of course, this started looking very worrying. You know, we thought running was really good for you, and yet all these runners are getting all these plaques and getting more calcium in their arteries. But what does this actually mean? When we started looking very, very carefully at the actual morphology of this plaque, this is the cheese and chalk hypothesis. You can have cheesy plaques, which are soft tissue, and they can rupture and cause the artery to block. Or you can have chalky plaques that are strong and solid. They don't rupture and cause heart attacks. So the dark blue bar was the chalky component of the plaque. The yellow was the mixed, and the green was the cheesy plaques. And here are the athletes and here are the controls. And you see that although the athletes had more plaques, our athletes predominantly had chalky plaques, suggesting that exercise does cause wear and tear of the coronary arteries, because the coronary arteries are surrounding the heart, and as the heart's beating vigorously, it's like an elastic band being stretched and unstretched. The repair mechanisms that these athletes had were different to the repair mechanisms with people with hypercholesterolemia or diabetes or high blood pressure. And this repair mechanism probably mitigated the risk of a heart attack and may explain why we don't see so many heart attacks during marathon runs. And another Dutch group looked at the relationship between exercise and the amount of exercise and these plaques. And you'll see they divided people into 1,000 MET minutes, 100 to 200,000 MET minutes, and over 2,000 MET minutes. The more you exercised, the higher the amount of your coronary artery calcium score of more than 100. And also the higher the amount of coronary plaques. But again, like our study, these plaques were calcified. So the hypothesis is that repetitive mechanical stress, maybe a hypertensive blood pressure response to exercise, or even inflammation, may cause some wear and tear in the coronary arteries. We suspect that the sex of the individual, the amount they exercise, their genetic predisposition may also contribute. And this may have what looks like, to the media at least, bad consequences. But we haven't been able to identify any bad consequences of increased calcification in our runners. And the other thing I should say, the good news for women, we did this study again, we repeated it in a load of postmenopausal women. And again, funded by the BHF, we haven't published that data yet. We could not find any excess calcium in the women. So it's the relationship like AF, just like when men exercise, their risk of AF goes up with increasing exercise, women's risk goes down. And it appears to be that they seem to be protected with exercise. The more exercise they do, the better they do with respect to their cardiovascular system. Let's finish with the ugly very quickly. People do die during sport, and when they die, you hear about it very much in the news, just like Christian Eriksen's event, for example, at the European Championship. I'm glad to say that these events are very rare. They affect about 1 in 50,000 people, and they hit the headlines when are very high profile athletes involved. And again, a lot of research has gone into this with the BHF of methods of how we can identify these people quickly, because the cardiomyopathies are the commonest causes of death in young sportsmen. But I'll miss this slide because the slide just tells you that clearly exercise puts on stresses onto the heart. So if you've got an underlying condition, it may put you into a dangerous rhythm. But I want to talk about the general population. If you look at the top elite athletes that make the headlines, they only make up 6% of all deaths in sport. Most deaths in sport occur in recreational individuals aged between 40 and 60, usually male, and these deaths are due to coronary artery disease. So the question is, how do we prevent those? And I'll come to those in a minute. Again, just starts with some bad stuff. This study of about 1,200 people who had heart attacks was just asked, what were you doing when you had your heart attack? And this study showed that you were 6 times more likely to have a heart attack during exercise than at any time in your life. But if you were a regular exerciser, and you exercised, you reduced your risk of having a heart attack by about 50-fold. What about the risk of sudden death? Again, this was a study of 21,000 well-to-do people who were followed up for 12 years, during which there were 23 sudden cardiac deaths. This study showed that you were 17 times more likely to have a sudden cardiac death during exercise than at any other time in your life. But that risk was mitigated by your fitness levels. So what this study tells you, if you're suddenly going to listen to me and say, right, I'm going to run the marathon, I've not done any exercise for 10 years, that is not a good idea. You've got to build up very, very slowly. If you've got risk factors, if you're getting chest pains and things, you need to see a physician before you go to do that. So that's because if you've got a plaque like this and you're exercising, you can rupture your plaque. If you're sitting on a tight stenosis and you get an oxygen demand oxygen demand and supply issue, you can go into a bad rhythm. So you need to be checked out if you've got symptoms and lots of risk factors. So what we do to prevent sudden death in young athletes, we screen them for cardiovascular disease. You can't screen lots of middle-aged people because coronary artery disease is not easy to identify unless you do lots and lots of tests. So we must educate everyone that if you've got risk factors or chest tightness or chest discomfort or a family history, you probably need to have an assessment. We need to push on this availability to teach CPR for everyone and get AEDs for everyone, and eventually make allowances for the environmental conditions. I'm sure pollution has got a lot to do with what happens to people's hearts as well. So I'm sorry I've gone on a bit, but thank you very much for your attention.
Oh, thank you, Sanjay, for so clearly describing the brilliant research that you do. I love the way you described it as the good, the bad, and the ugly as well. That really brought it to life. And indeed, for reminding us that none of that research would be possible without the support of people on the call today and across our BHF family, for which we're deeply grateful. I would love at some point to come back to the kind of CPR and survival work as well. We'll see if we get some time to do that in questions. Sanjay, before I draw Roger in, just tell me in a couple of sentences what got you into this work. You're clearly deeply passionate about it, and we've learned a lot about cardiovascular health from studying athletes, and Roger can share a bit of his experience in a moment. What got you into this on a personal level?
Well, just the fact that I was reading about athletes dying, it doesn't happen a lot, but when it does, it captures the heart of the nation. It captured me, and I wanted to know what the causes were. And I wanted to know, how do you tell the difference between hypertrophic cardiomyopathy, thick heart muscle, and an athlete's thick heart muscle? So I started work. I got a BHF grant to do that. And I made contact with lots of sports people, and I really got into sport, exercise, and how the heart behaves. And it's just really gone on from there.
Fabulous. Oh, how exciting. And Roger, it's my pleasure to welcome you, of course, to this live event as well. And would love to hear a little bit about your views. You must have thought about your cardiovascular health so much in your career. And I have to tell you, on a personal level, I'm really glad I've done my swim and walk, but I'm not sure I'm quite ready for a marathon yet. But yeah, tell us a little bit about, I guess, your thinking and how much exposure you've had to kind of cardiovascular research and health in your career.
Well, yeah, thank you, Charmaine, and good afternoon, everybody. Firstly, Sanjay, this may sound strange. I'm 55 years old now, and in the last 10 minutes, I have more understanding. You would have seen me smile a few times and scratch my chin, because I'm going back in my past to moments during my athletic career when doctors would look at me and say things and question things. And now I understand the panic they had on their faces. I mean, every operation I had, my pulse was very, very low. So low, as you know, with some athletes, that when you're about to go under anaesthetic or coming out, they really panic because your heart rate goes down. But you're talking about the difference between a large heart in an athlete and a large heart in someone who's not an athlete, and which way do we go? Well, I had both. And it was it was always a balance for my specialist throughout my career, and that's why I was monitored. So I'm going to explain what the situation is. Not everybody knows my story, and so I sit here today with somebody who has spent their whole life having this very strange description of having chronic heart disease, yet somebody who exercised at an extreme level and won many, many medals in the world of athletics and stood on the Olympic rostrum twice and the World Championship, winning 2 gold medals at the World Athletics Championships. Yet I've lived my life with heart disease. And that's a very strange thing for me to say, and maybe strange for people to connect with, because there's heart disease and there's heart disease. So my story is I was born with an incompetent aortic valve. Now, I didn't know this until I went to my senior school, age 11, and we had the school medical, and the school doctor was listening to, we were all lined up, and you go in and they check you out and they listen to my heart, and they heard a problem. You could clearly hear that something wasn't right. My father was a GP, but I guess he'd never listened to my heart in those 11 years. And I was taken off to Southampton General Hospital to see the cardiothoracic department there. And from the age of 11 to my age now of 55, I'm now on my third or fourth consultant. For many years, I was under a consultant called Neville Conway, and then Hugh and Gray, who are names that I'm sure people of the British Heart Foundation know. And it was very, very strange for me, because I was your classic 11-year-old kid who loved sport. I kicked a football every day of my life. I ran around the streets. I was always active, and I could run fast. And to be then told that I had a problem with my heart, I had a leaking heart valve, and then in my first term of school being told that I was not allowed to do any competitive sport, that was very odd for me, because sport was what I was good at. Sport was what gave me my significance. I wasn't particularly academic, but sport was the thing I thrived at. And I was told for the first 6 months of my school life that I couldn't compete in any competitive sport because I had a heart condition. Now, that was very, very strange for me, because I was faster than everybody. I was okay, and I felt absolutely fine. So that was a shock to me. And eventually, I would be seen every year. Well, it was twice a year back then when I was 11, but every year my heart was monitored, and my heart has been monitored ever since then. And eventually they relaxed the rules and they allowed me to compete. So I would play on the wing playing rugby. But often one of the most asked questions I get as an athlete, or as a retired athlete, is, why didn't I do athletics when I was a kid? I didn't join an athletics club until I'd left school at 18. I became an athlete because I messed up my A-levels, actually. I was this very, very fast runner, but I never, ever considered training for athletics or becoming a professional sports person. And I often wonder if that really was because I knew that I had a heart condition and that I couldn't achieve that. But I got through my school career. I loved sport. I didn't feel I had any complications. And then when I actually messed up my Maths A level, so had to take a year off before going to university to, ironically, train to be a doctor. I joined Southampton Athletics Club and started training with a group of Olympic athletes. You will have heard of one of them, a guy called Chris Akabusi, who's my training partner and best friend, and I trained with throughout my career. And it was very, very strange and very worrying for my father, who was a doctor, but also for my consultants, because I went from just being somebody who liked sport and did sport into an extreme training environment, coming back home every night exhausted, pushing myself, taking myself to a limit of physical exercise that you have to do to one day stand on the Olympic rostrum. But if you're somebody with a heart condition, it's probably not very advisable. So it was a period of great concern. But because I was monitored every year, because my heart was always monitored, my specialists were always able to look at me, to test me, and then give me the go-ahead to keep on training. So I had an athletics career that lasted about 14 years. And every year, once a year, I had to drive down to Southampton General Hospital, sit in the waiting room. And that was very weird for me because I had quite a high profile at the time. And there would be people sitting in the waiting room ready to see the consultants. And I would be sitting with them and they'd think, what are you doing here? And I was always very aware that my heart disease clearly wasn't causing me any problems. And there were people in the waiting room who had either had heart attacks or had similar diagnoses to me, but their valve really was causing them a lot of problems. So I was very aware of that. But I also knew that every time I went into that door and I had the tests and I had all the tests done and the echoes and everything, I was always very aware that I would walk in that door and I may walk out of that door being told that I had to stop my athletic career because my heart had changed. Fortunately, that never happened to me. My heart grew disproportionately, which Sanjay will probably have an understanding of that. There is a theory that my heart overcompensated for its inefficiency because one of my valves obviously doesn't work, so the blood goes out, but the blood comes back in. That's what they could hear. And there's a theory that the heart may have overcompensated throughout my life, and actually I have a very strong heart, which may have even benefited me. That's just a theory. I don't know if that's true. Sanjay may have a thought on that. I would say that the only year I didn't go to my appointment was towards the end of my career in 1996. In 1996, I was going to my last Olympic Games. I'd never really delivered at the Olympic Games, and I was in really good shape. And it was my last chance of standing on the Olympic rostrum. And for whatever reason, I was unable to make that appointment. The reason was I knew that no matter what I was told, I wasn't going to stop training. Fortunately, I carried on racing and won this medal here, my Olympic silver medal, coming second to the great Michael Johnson, one of the greatest athletes of all time. And when I stood on that rostrum, people often ask me what that felt like. You have a mixture of emotions, jubilation, pride, and whatever, but I felt complete. I felt that I'd achieved everything I could. And when I stood off that rostrum, a part of me changed. And since that day, I've never really pushed my heart to the levels I ever did as an athlete. And I'm really pleased that I haven't, because I did put the truth is, when you're an athlete and you're so focused on what you're doing, I did block out that I had a heart condition, because it made no sense to me, because I was able to be a world-class athlete and my recovery was good. But I was always aware that I did have a condition. And the day I retired, I've respected my heart far more than I ever did as an athlete. And by the way, I had one scare throughout my career. Any of you that have heart valve complications, one of the times that it really came to my awareness was every time I had to have dental treatment, I had to have antibiotic cover, so that I didn't get bacterial endocarditis. And I was rushed to hospital in 1989 and spent a week having blood tests done to me, because I did have symptoms of bacterial endocarditis. I actually didn't have it. I had something called psittacosis, which you catch from birds. But that was the one time where it became a reality to me, to spend a week on the cardiothoracic ward at Southampton General Hospital as an Olympic athlete. That was scary. That was scary. So I do understand, obviously, that what it's like to live with heart disease. It's a very different situation for me now. I'm 55. I respect my heart more than I've ever done before as I get older. Exercise for me now is not about trying to win Olympic medals. It's not about stressing my heart. It's not about pushing myself. It's not about setting physical challenges or physical goals. It's about general well-being for me. And it was interesting listening to what you were saying, Sanjay, about the kind of exercise you should be doing. And that's what I'm doing. I go for a 30-minute gentle jog, and it really is a gentle jog every day. I really believe in the power, not of fitness, but of moving. I make choices every day to move. I'm very lucky I don't have a particularly sedentary lifestyle. But as somebody with heart disease, and I know I have heart disease because my insurance premiums are higher than most people, always have been, I respect my heart more than ever before. So when it comes to exercise, I'm a great fan of just making it a habit, regular exercise, but not stressing yourself too much. Set a goal, understand why you exercise, and different people exercise for different reasons. I've met many people who have had the dramatic heart attack, and as a result of that, they then exercise for the rest of their lives because of that trigger. But I also meet people like myself who have a heart condition, and we have to respect that. And exercise is just absolute common sense for all of us with heart disease. Fortunately for me, I've exercised all my life. But what I'd like to stress is that, and often people don't believe this, I really don't push myself at all anymore. It's just general exercise, a run, maybe get on a rower, maybe get on a bike, but I don't push myself anymore. It's less is more, and it's part of my life. And that's actually why I have my business, Roger Black Fitness, which we have treadmills, bikes, and we're all about exercise. And most of our customers are age 50 plus. They're most people who just need to move. For me, it's not about fitness, it is about moving and encouraging as many people to move, whether they have heart disease or not. But we just need to move more and more and more. So for me, I'm somebody who's experienced moving at an extreme level to do extreme things, to put extreme pressure on my heart to stand on the Olympic rostrum. But I'm also somebody who believes in the power of exercise, the power of movement, not just for the physical benefits, but for the mental benefits as well. And it's a lot easier now to be exercising at 55 than it was at 25, I can assure you. So that's really my story. It's still strange that I get to talk about it. It's real. In fact, I have to share something with you. I had to cancel my appointment. It was due today. And I had to say, I'm sorry, I can't come in on the 26th of January. I didn't say why. But I'm in Southampton General in about 2 weeks' time for my checkup. But it's a strange situation to be in, and if there's anything, you know, I don't know if I'm an example of somebody who's pushed through. I don't think I am. I think I'm somebody who has, by definition, chronic heart disease. But I'm very, very lucky because it hasn't affected me. I really don't think it has. But I think maybe that's because I'm one of the lucky ones that from the age 11, I've had my heart checked up every year. So, you know, my heart's probably been checked more than most people's, or certainly more than most people's, and that's given me peace of mind. And now, by the way, if I walked into the room and I was, well, I would be told to keep exercising, but because I'm not pushing. But it's a much more pleasant experience to have the checkup now than when I was an athlete.
Roger, thank you so much for so generously sharing your experiences and about you not just the Olympic training, but your kind of personal diagnosis as well. I know so many people on this call will resonate with that, having a condition themselves, and be inspired by it as well. What an inspiration! But don't tell anyone you've changed your checkup appointment for the British Heart Foundation. Well, that doesn't feel right, Roger.
I didn't. This was important for me to do this as an ambassador of the British Heart Foundation. But I think this is an important message because.
Agree.
And Sanjay has articulated it far better than I could. For me, you know, if you have, even if you don't have a heart condition, for me, you know, as human beings, and I'm not talking about going to the gym and trying to push it. we've just got to move more, and we've got to be careful about what we eat and move more. And if we have a heart condition and we respect our heart, as Sanjay said, nothing compares to exercising to benefit our heart. And if you can make it a habit. If you can, by the way, a few tips. The big one is if you can find somebody to train with or to exercise with, to go walking with, to commit with. I trained with Chris Akabusi. It wasn't the physical. The fact was I would never let him down. I would always be there for him. He would be there for me. Find somebody to exercise with. Share your exercise. Share your journey. But you know, we do need to respect our hearts as we get older, and not exercising is really not an option for me.
Yeah, thank you, Roger. And Sanjay, you so clearly described that with your data and your expressions about your research as well. I'm going to open up for questions now, because as much as I would love to listen to you guys just myself, I know we've got dozens and dozens of questions coming in. So I'm going to turn to Leanne in our team just to introduce questions for either Roger, myself, or Sanjay, or we've also got Tracy and Ruth with us as well. Over to you, Leanne.
Thanks, Charmain, and thank you, Sanjay and Roger, for joining us today. Your research, Sanjay, and your story, Roger, they're inspiring. And you can tell us we've received a lot of questions from the audience, so I'm just going to get right to them. Ruth, we've got a few questions that I think you would be able to help answer. So one of them is, will exercise stabilize or decrease irregular heartbeats?
Just to say thank you for having me, and it was lovely to listen to both speakers. Just to reiterate what Dr. Sharma said, the heart is a muscle and it will respond really well to exercise. But if you do have an irregular heartbeat, it's important that you have had this checked out and signed off by a doctor to make sure that they're happy for you to exercise, because in some cases, exercising can make this worse. Exercise can reduce your risk of the irregular heart rates, like Dr. Sharma said, but ultimately it can improve the overall function of your heart. Exercise, heart-based sort of friendly exercises such as walking, swimming, running, cycling, they're all really great examples of what you can do. And you can start by doing them at a pace and an intensity that suit you and your symptoms. We've seen that you should be aiming like for 150 minutes a week of moderate intensity, but just know your body and know yourself with your symptoms. If your symptoms or you feel that it's too much, dial it back. Or if you're finding it too easy or you want to safely go for a bit of a further challenge, then you can always ramp up that intensity as well.
Thanks, Ruth. We've got another question for you. What type of exercises can I carry out pre and post heart surgery? I think it's quite an important question, this one.
It is, and the big point with this, it very much depends on you as the patient and how symptomatic you are and what instructions that you've had from your surgeon and your specialist. So pre-surgery, if you're very symptomatic, you may not have the capacity to exercise, so you may want to do sort of light intensity. And then again, your surgeon may have told you to not exercise at all. Keeping active can be beneficial to your recovery. So if you're mobile and able to walk around preoperatively, it's going to be easier for you to get back to that stage postoperatively because you will have that fitness already, and then that will help with your recovery going forward. If you've been told you can be active, then very much be guided by your symptoms. If you develop any symptoms or they get worse when you're exercising, stop, recover, and then consider possibly doing a lower intensity activity such as walking or chair-based exercises. Post-surgery, again, it's going to be down to what your surgeon has said and what you feel like doing yourself. You may be invited to cardiac rehab classes, and these are a really valuable resource, and they'll be able to guide you on how to increase your exercise, and it's a group, so you've got that motivation, and your peers have been through similar circumstances than you. If you are doing it alone, you can start doing sort of cardio-based exercises like your swimming and your running once you've been seen by your surgeon and they're happy for you to do so. Take it easy to begin with. Consider starting a little bit slower and build it up. And then when you start to feel stronger, then you can start building up a bit further and get yourself back to peak fitness. It's going to benefit you and your heart.
Thanks for that's really good advice. Perhaps you could help answer this as well. So someone says, I have a condition which is so severe and debilitating. I exercise very little. Could this cause a heart attack?
I can really appreciate that being unable to exercise can be very difficult. And if you have a condition that is so debilitating, it can really affect your physical and mental well-being. Being inactive can increase your risk of developing problems that can cause heart attacks, but it's not the only factor to consider. So there's lots of things that you can think about. To help reduce that risk or developing a condition that might cause a heart attack, it's important you address other factors that you can control, like not smoking, eating a healthy diet, and monitoring your alcohol intake. If you're under a specialist team for your condition, you could ask them for support or direction for what sort of exercise you can take. Like I said to previous questions, you could try chair-based exercises to start with and set yourself small achievable goals. On our website, just to highlight, we do have a lot of information on chair-based exercises and some examples. So if you are here listening and you're wanting to start that, then go on and have a look after this session, and hopefully that will be a good start for you.
Thanks, Ruth. And just one last question for you. Is walking 10,000 steps a day as a target just a PR invention, or is it a realistic target?
So the 10,000 steps is not necessarily a research-based target. However, people have found that having a set goal to achieve, like what Roger said, it can motivate them to be active. And you may be really surprised at how quickly the steps can add up from just going from a walk around your local street or from climbing a hill. It's important that you do set a target that suits you, though. You could start by saying, right, I'm going to try and take 6,000 steps today, and then build that up slowly. And if you're building up your strength and activity levels, you should start feeling the benefits. The key is to set the achievable goals and stay motivated. And that's going to be the key to keeping that positive change going. And it's the same with exercise, changing your diet, everything that can contribute to good heart health.
Yeah, and I could see Sanjay nodding vigorously at that. So Sanjay, that you're nodding at the point about setting your own goals. Any wisdom to add for the people joining us today?
Absolutely. It's not easy to do 10,000 steps. I mean, it's clearly it's a goal, but you need to set goals that really meet, your ability, I think. But any exercise is better than none. But I think if I said to you to go and do a 30-minute walk, you wouldn't hit 10,000 steps, not in 30 minutes.
Can I add something to that, if you don't mind?
Please.
You're right when you talk about goal setting. You should, yes, absolutely, you should set the goal that you feel is right for you. But I think one of the things that's really important is no one knows your body and how you feel better than you do. And that awareness of listening to your body and not waiting for someone to tell you what you should do or when you should stop, when you should go. No one knows how you feel better than you do. And having that awareness when it comes to starting exercise or having an exercise program is really important, because you should be able to regulate when you should back off or when you can push a little bit more. Because to expect the doctor to tell you how many steps you should do or what you should do, it's a guideline. But take ownership of your body and your awareness. And I think that's a really powerful thing, because that's the truth. No one knows how you feel better than you do.
Thanks, Roger.
Thanks, Roger. Sanjay, we have a question for you, and it's about whether there's any research to find out the glue that sticks cholesterol to the arteries, rather than just trying to lower cholesterol. I think it's a very good question.
Well, the glue that really sticks the cholesterol to the arteries is the fact that the lining of the heart tears or gets damaged. So basically, the way to actually stop cholesterol from sticking to the arteries, I mean, what cholesterol is just a component of plaques. So what happens initially, of course, is that you get a wear and tear in the lining of the heart, and that wear and tear may be due to high blood pressure or high cholesterol or diabetes causing sort of coating certain proteins in the lining with sugar. So all of these cause damage, and it's this damage then results in an inflammatory reaction whereby cholesterol particles then start depositing in the vessel. So the aim really is to prevent anything that actually starts to cause damage of the actual lining of the arteries, and that's to aggressively reduce the actual risk factors for atherosclerosis.
Thank you, Sanjay. And another question for you is, I was diagnosed with an enlarged heart on a chest X-ray done for asthma and chest infection. I was training for Ironman and I'm fit and healthy. Since finishing Ironman in July, I'm not training as much. Does my heart go back to normal size?
Well, firstly, Roger will tell you that most men that have a chest X-ray, if they're training for an Ironman, will have an enlarged heart for sure. So the only way to be absolutely sure about whether, so when someone's heart becomes big with exercise, they normally have preserved contractility of the heart and preserved filling of the heart. And when that stimulus goes away, just like your biceps go down if you stop going to the gym, the heart also goes back to normal. There are people who've done 3 or 4 Olympic marathons, Olympic events, 4 consecutive ones, so who've done 20, 30 years of hard exercise. There is some data suggests the heart doesn't always go completely back to normal, but in the vast majority it does. So, when you detrain, 6 weeks of detraining, the heart shrinks back to normal. We know that from our Premier League football players who are tested pre-season and usually post-season. So you can see there's a 10% change in their cardiac size. It should go back to normal, yeah.
Thank you, Sanjay. We've got a lot of questions coming in, but Roger, one for you. And it's about, was it a relief to be able to stop pushing yourself, or was it all to just have to adjust to slowing down?
When I retired, it was a relief, nothing to do with my heart, actually. It was a relief just because it was just your body hurt the whole time and the pressure. So yes, it was a relief physically. And you get 2 types of athletes. You get athletes who love the training and love the challenge, and they just carry on for the rest of their lives. And then you get athletes that just go, oh, I'm just going to relax now. And I was in the latter camp. So yes, it was a relief. And I've never trained like that again. But I think my heart condition probably, played its part in that. But yeah, it's a completely different form of exercise now. But yes, it was a relief that it was over. I was quite lucky because I was one of those athletes and I had my best day towards the end of my career. The hardest thing is when you've had it early and you retire and it's a distant memory. So yeah, it was a nice relief to have a normal life.
Thank you, Roger. We've got a question from Nick Harrison, probably to you, Sanjay. Can you explain why the warm-up and cool-down are so important if you have a heart condition?
Yeah, yes, I do, because clearly one of the things that what has to happen in the body is the get up and go hormones have to kick in. So, you find that's why people say, why do so many heart attacks occur for very, very early hours of the morning? And when you get up, there's suddenly a rise in these so-called stress hormones. They're not stressful, but they're to get us going. So if you've got an underlying heart condition, you suddenly don't warm up, and there's a surge of adrenaline and noradrenaline. That sort of surge can put a lot of pressure on the heart by putting the blood pressure up, by narrowing the vessels suddenly, by making the heart work very hard. So if you've got a tenuous cardiac condition, you could run into trouble with that. And that's why we always say that a good 10-15 minute warm-up is a very good idea before going into something a little bit more vigorous, because by the time, the heart needs to get used to the adrenaline level. So there comes a point where, and it rapidly gets used to, the human body is amazing. So it rapidly gets used to this circulating adrenaline level, and it copes with it much, much better than a sudden surge.
Thank you, Sanjay. Maybe one more question before I hand it over to you, Charmain, to close the event. I think one for you, Ruth, and it's about whether lockdown has curtailed exercise, and now I feel like I can never get back to fitness. Is it too late to start again? It's a very good question at this time, isn't it?
It's a really good question, one that probably lots of people are thinking about at the moment. And the answer is absolutely not. Treat every morning as a new start and a new chance to make a positive change. The fact that you are wanting to get back in shape or start again is the first and often the hardest step of making that change. If you do start taking exercise, like Roger, Sanjay, and myself have said, make those small, achievable goals, know your body, and try to keep yourself motivated. Try and find a gym partner or a walking partner. You may want to track your progress if you're one of those people who likes to use apps, just track what you're doing or join a group to get that peer-to-peer support. That motivation and that achieving your goals and knowing your body, that's going to what's keep you going and improve your fitness and really help you coming through the really difficult times that everyone's been going through.
Thank you, Ruth. And I think that's all the time we have for questions. I'll hand back over to you, Charmaine. Thank you, everyone.
Thank you, Leanne and colleagues. I'm just going to turn to Sanjay and then Roger actually and ask if there are any final words that you'd like to share with our audience. I know we've loved hearing about your research, and Roger loved hearing about your experiences and your approach to moving as well, and what you're up to at the moment. It's just fantastic to hear. So Sanjay, first, any final words before I wrap this up?
I'm probably just going to be repeating myself, and just to say that any physical activity is better than none. So for those of you that are very debilitated, and for those of you that are thinking about starting, start. And if you think it's too late to start, it's never too late to start. So do some physical activity, do something that's better for you than any drug I could ever prescribe in my cardiology clinic.
Thank you, Sanjay. Roger.
Yeah, for me, I get very inspired when I see people who clearly haven't done any exercise throughout their lives, and then they make that choice and they start by walking, and you see them out walking on the streets, and you have huge respect for them because you can see that it's not something they're naturally done. And then you see them in a year's time and they're jogging and they've lost loads of weight, they seem happy. And so it really is less is more. This is so corny, but if you're getting into exercise, see it as a marathon and not a sprint. Really take your time, and those little steps of doing something and reading your body. It's amazing, as Sanjay said, the human body has an amazing capacity to adapt and to change very quickly. And so be patient, make it a habit, make it part of your life. And if you can exercise sooner rather than later during the day, I've always found that easier because something always gets in the way, and you don't get around to doing it if you leave it till later on. So if you can do it sooner rather than later, but find a buddy and just keep moving. Just keep moving.
Brilliantly put, thank you. Well, you've inspired us all, I'm sure, to get out the trainers and think about whatever level we're at to do a little bit more moving. So thank you. I know everyone on this call will join me in offering our heartfelt thanks to Professor Sharma and to Roger for their time today. It's just fabulous to have your support for the British Heart Foundation. So thank you. And I really hope you've enjoyed this live and ticking event, and it's given you some inspiration and some things to think about as you start your 2022 as well, with and use every opportunity to keep moving and looking after our hearts. I know it's certainly given me some food for thought to get my trainers out tomorrow morning, even earlier than I normally would, Roger. So we've loved having you with us. We've loved your questions. I'm really sorry we don't have more time. I'm sure we could fill many hours listening to Sanjay and Roger and answering your questions, but we will endeavour to get back to people and also share our responses on our website. I also meant to mention I've had the privilege of interviewing Roger for one of our podcasts. So if you want to hear a little bit more about his story and get inspired as I certainly was, then please do, again, check that out on our website. Otherwise, I'll wrap up by saying I hope you're inspired. There's lots of support and information at bhf.org.uk if you need it, and a community to help you as well, and to whether it be about exercise or other things that matter to you and your loved ones around heart health. Please do join in, it's there for you. And also to say thank you to you as our supporters. We could not do anything we do without the support of so many people across the UK. So I just want to say a personal and heartfelt thank you from everybody in our BHF team. And if you enjoyed this, then please do tune into our next live and ticking event, which is on the 17th of February, and it's going to be around inherited heart conditions, actually, as it turns out, and it's going to be with a really fabulous member of our team, Fergal McKinney, who's head of our BHF Northern Ireland team, and a whole host of experts and specialists. So please do sign up for the next one if you've enjoyed this, and tell others about it too. And lastly, there'll be a short survey. We love hearing what you think. It helps us optimise our what we bring, what we focus on, helps us choose the things we know will be interesting to you and important to you as well. So taking just a couple of minutes to fill that in would make a huge difference to us. So please do as well. But otherwise, I wrap up by saying I hope you've enjoyed it. It's wonderful to have you with us. Thank you again for all your support on behalf of the BHF. And again, huge thanks to Roger and Sanjay in particular for joining us. Thank you, everyone. Take care.